Muted.
Good afternoon, everyone, and thank you for joining the ADMS Compliance Department team for its webinar Wednesday for today, Wednesday, May 18th, 2016. The ADMS Compliance Department offers Webinar Wednesdays, a monthly educational webinar series taught by members of the Compliance Department and the Nurse Administrators Center Compliance Officers will address best practices in compliance, ethics, code of conduct, and policies and procedures which will assist and aid in your facilities, office, and team locations. This education will allow you to plug in and access learning on the go. All employees, privileged staff members, and physicians are invited to attend. I have muted all phones to cut down on crosstalk, and in addition, we're going to ask that everyone hold any questions or comments till the very, very end. During the course of the process, if you do have questions, you can type those questions in the lower right-hand corner of your screen, which you may be seeing in the GoToMeeting webinar. If you're on the phone, we would just ask you to hold those, and we will take those calls. So with that being said, why don't we begin with this week's seminar, or this month's seminar, pardon me, on the ADMS Compliance Program and its Code of Conduct. Please note that the terms Atlantic Dialysis Management Services and ADMS in this program refer both to those specific organizations in addition to its contracted network of affiliated dialysis centers and physician practice locations. A copy of this webinar will be placed on the ADMS website in the next few days. Visit www.atlanticdialysis.com to listen and view this and the other educational programs offered. Some of the learning objectives today. After completing this training module, you should be familiar with the following items: the compliance program, the corporate code of conduct, specific laws that govern healthcare compliance, and also how to report suspected noncompliance. So in the area of compliance and ethics, what is compliance? In its simplest form, compliance means following a rule or request. In healthcare, when we talk about compliance, we refer to following rules, following regulations, policies and laws created by the government, insurance programs, and commercial payers. The ADMS Corporate Compliance Office staff consists of the following individuals. William Cundiff is the Enterprise Compliance Officer of Atlantic Dialysis Management Services. Team members Ricardo Sime, Carrie Richmond, and Alex Osorio are also members of the Compliance Office at ADMS in College Point. Saj Basabathini is the Compliance Officer for Matu and Bott Medical Associates, PC, the nephrology practice. At Astoria Dialysis Center, your Compliance Officer is Janice Valenti. At Broadway Dialysis Center, your Compliance Officer is Lydia Nakawa. At Central Brooklyn Dialysis Center, William Cundiff acts as the Interim Compliance Officer. At Central Park Dialysis Center, Marty Umang is the Compliance Officer. At East End Dialysis Center, Tracy Lind acts as the Compliance Officer. At Morrisania Dialysis Center, Ronald Pasquale acts as the Compliance Officer. At Newtown Dialysis Center, Marizin Bernales acts as the Compliance Officer. At New Hyde Park Dialysis Center, Digna Ignacio acts as the Compliance Officer. At New York Renal Associates, Ronald Pasquale acts as the Compliance Officer. At Prospect Park Dialysis Center, Winston Powell acts as your Compliance Officer. At Ridgewood Dialysis Center, Lillian Manahan acts as your Compliance Officer. Springfield Dialysis Center, Tess de Guzman acts as your Compliance Officer. West Nassau Dialysis Center, Nancy Beltran acts as your Compliance Officer. And at Matu and Bott Medical Associates, the Acute Division, William Cundiff acts as the Compliance Officer. Please contact your local Compliance Officer if you have any questions or comments. So in ethical corporate culture, some of the benefits are that ethics plays an important role in deterring both fraud and abuse in organizations. The overall goal of an effective compliance program such as we have here is to create an ethical corporate culture. An ethical corporate culture reduces the chance that fraud and abuse will occur, or if it does occur, will reduce the chance that it will go undetected. So what is ethics? Quite honestly, ethics simply means doing the right thing, and that goes beyond what is allowed by laws and regulations. What's the philosophy that we have regarding compliance and ethics? ADMS and its network of contracted affiliates will fully comply with all applicable federal and state laws, regulations, standards, and other compliance requirements at all levels of government and within the various health professions employed at ADMS. We will not pursue any business opportunity that requires unethical or illegal activity. Taken together, these items define the essence of our compliance program, and that is a value-based culture that guides our actions in the workplace so that our daily activities are performed with honesty, integrity, and in support of our organization's mission, vision, and values. The ADMS compliance program was established to assist our organization in promoting its commitment to the highest legal and ethical standards. This program has the commitment of everyone, including the physician owners, various governing body members, senior management staff, privileged physicians and staff members, employees, vendors, consultants, and others associated with ADMS. The program provides education, conducts investigations where there are allegations of misconduct, takes part in monitoring activities such as audits to assess areas of risk within the organization. The program also provides a proactive approach to compliance, thereby helping the organization maintain its commitment to the highest level of compliance and ethical standards. Compliance is part of all of our jobs within this organization and really depends upon everyone's participation for its continued success. The compliance program includes the 8 elements of an effective compliance program as defined by the United States Federal Sentencing Guidelines. So we're going to go into each of these 8 elements briefly. Number 1 is there must be a written standard of conduct and policies and procedures that promote the organization's commitment to a compliance. Number 2 is there has to be a compliance officer assigned to oversee the compliance program. The third element is that there must be education and training for all new hire employees and then annual training for all other staff members. There has to be a process under step 4 to receive anonymous complaints and to allow complaints from staff to be made without any fear of retaliation, for example, calling the ADMS Corporate Compliance Hotline. The 5th element requires the compliance office and the organization to respond to allegations of improper activities and, when necessary, assist in developing a corrective action plan. The 6th element is auditing and monitoring to ensure potential areas of risk. The 7th element requires the organization to be able to conduct investigation and remediation of identified systematic problems and a non-employment or retention of sanctioned individuals under the government exclusionary database lists. And the 8th element, which came upon a few years ago, is really to define the roles and responsibilities, assign oversight for compliance, and conduct an enterprise risk assessment program of the compliance program's effectiveness. So those are the 8 elements of an effective compliance program. Specifically, we have it here at Atlantic Dialysis Management Services and Affiliates. As required by the federal sentencing guidelines, ADMS has policies and procedures in place to ensure all-time compliance with all laws and all regulations. Some of the elements of a compliance program, and it's a top-down approach, as you can see from the screen in front of you. The ethical corporate culture starts at the top. And you can see the pillars of that corporate culture and the elements of a compliance program are established from the pillars that we just talked about within the elements. And those are standards and procedures, a high level of oversight, individuals that make up a compliance program or organization employing trustworthy individuals, regular education programs, conducting monitoring and audits, putting in place proper enforcement and discipline if necessary, and then responding and prevention. The reinforcement of the organization's commitment to compliance is really in the basis foundation of the governing body members of your respective organizations. Okay? And if you look at the screen in front of you, you will see that there are a number of external forces which come down to really enforce that we seek to establish and maintain that corporate culture, whether it comes from the Department of Justice, the Inspector General Office, CMS Medicare, or quite honestly, the Federal Bureau of Investigation. Those are individuals and those are entities which force the organization to really ensure that it looks introspectively as to how it conducts business and how it employs individuals and consultants. Element number one, to briefly jump into each element, are standards and procedures. And essentially, our organization must have established compliance standards and procedures to be followed by employees that are reasonably capable of reducing the prospect of unlawful activity. Those of you in compliance officers, you have your copies of your compliance programs, which are updated biannually. Employees and privileged staff members on this call or webinar who do not recall seeing a copy of the compliance program or need a copy should reach out to their respective compliance officer, and they can get a copy from them, and I would suggest all employees and privileged staff members keep a copy at file. We've developed and continue to develop policy and procedures to address many legal and regulatory requirements. But quite honestly, it's really impractical that we develop them in a whole series of policies and procedures that encompass the full body of laws and regulations that affect the industry. It's just too many. Obviously, a number of laws and regulations not covered in policies and procedures must be followed. ADMS has a wide range of expertise within the organization, including a number of functional experts who should be consulted for advice concerning areas of human resources, billing, collections, and compliance, legal, and other regulatory requirements. One of the most critical components that supports the requirements that we have standard procedures is our ADMS Code of Conduct. And the purpose of the code is to articulate the message of fair competition and ethical business practices. Our Code of Conduct addresses some of the complex legal and business issues that we face every day and provides guidance for handling some specific compliance scenarios. The code should be used in conjunction with policies and procedures to provide guidance on regulatory matters. There is a database and a repository of all policies and procedures committed to writing that is maintained in the ADMS Compliance Office here in ADMS College Point, and you can contact Gary Richmond if you are seeking a specific policy and procedure or looking for an updated copy. The second element is a high level of oversight. Specific individuals within high-level personnel of the organization must be assigned overall responsibility to oversee compliance with such standards and procedures. Now, there are local-level compliance offices at the dialysis centers and the nephrology practice. There's compliance office staff based here out of the ADMS College Point office, and then there is the ADMS Enterprise Compliance Officer. And we are the compliance organization who provide the high-level oversight under Element 2. Element 3 is that we engage and employ trustworthy individuals. The organization must use due care not to delegate discretionary authority to individuals whom the organization knew or should have known through the exercise of due diligence had a propensity to engage in illegal activities. Essentially, what the Human Resource Department and ADMS Compliance Office conducts background screening and background checks on employees. And these far extend past the concept of calling references and saying, what is your opinion of person X as an employee? The government puts out a series of 3 or 4 governmental database exclusionary lists, which list individuals and organizations who have committed certain levels of fraud, crimes against patients, criminal health care fraud, and certain level felonies. And the statute's written in such a manner that no one who's listed on these lists, no one who's placed on these lists can be employed or can be contracted with to conduct services within ADMS or its affiliates. So the ADMS Compliance Department, aside from the Human Resources Department conducting pre-hire background checks to the exclusionary list, the ADMS Compliance Department performs monthly checks against the federal and state governmental database to ensure that no sanctions have been imposed against ADMS employees and physicians that expose ADMS to any financial risk. If an individual or organization is found to be on that list, the statutes are written in such a manner that the organization will have to dismiss that individual or company from servicing the patients and employees at Atlantic Dialysis Management Services. Element 4 is education, and this start of the monthly webinar Wednesday series is part of that education component, and this extends past the annual training that we do each year. The organization must have taken steps in step 4 to communicate effectively the standards and procedures to all employees by requiring participation in training programs or by disseminating publication or information that explains in a clear manner what's required. In essence, number one, ADMS has incorporated an ethics and compliance training program. We have a new employee orientation program that contains specific training on ethics and compliance. And the specialized training, such as we're doing today, is provided on certain areas on an as-needed basis throughout the year. Again, there are monthly items through the end of December. I believe the next course is on June 29th, which will talk about HIPAA and some of the new HIPAA rules that have been coming out and how liability transcends violations and so on. Element 5 is the concept of monitoring and auditing. An organization under the fifth element must take steps to achieve compliance with its standards. We have to be able to utilize certain monitoring and auditing systems designed to detect inappropriate conduct by employees or consultants, and by having in place a reporting system whereby employees can report compliance concerns without fear of retribution or retaliation. Every year, the ADMS Compliance Department develops an annual compliance audit plan, which outlines the areas that will be audited in order to ensure compliance with internal policies, laws, regulations, and contracts. These audit areas are determined based upon a risk assessment process, which is the eighth element, that considers the likelihood or the impact of noncompliance to the organization. Employees are educated about the resources available to them and their compliance concerns. So if you have a compliance concern, you should report, obviously, to your immediate supervisor or those within your chain of command. You should contact your local area compliance officer. You can call the compliance hotline, a confidential reporting service operated 24 hours a day, 7 days a week. And everyone should know this number now. It's 718-483-7403, or if you're in the College Point office, it's 1403. And be it known that anonymity of the person placing the report is protected to the extent possible as dictated by both federal and state law. If the investigation transcends to a larger issue, we may not be able to keep that anonymity of the reporter quiet. We may have to revert that to the federal or state authorities. The sixth element is enforcement and discipline. And essentially what this is saying is, what happens if I'm found to be non-compliant with policies and procedures? What am I doing something wrong that's in contradiction to policies, laws, and regulations? What may happen? Well, standards have been consistently enforced through appropriate disciplinary mechanisms, including, as appropriate, the discipline of employees and individuals responsible for failure to detect an offense. Adequate discipline of individuals responsible for an offense is a necessary component of enforcement. ADMS has a progressive disciplinary policy in place to deal with individuals who do not comply with the internal policies, laws, and regulations. The Compliance Department's responsibility is to present the facts of the case and provide supporting documentation and details as necessary. The HR department here at ADMS is ultimately responsible for disciplinary procedures as they deem appropriate. All employees have a duty to report instances of noncompliance in good faith, and individuals who report in good faith will be protected from areas of retaliation and retribution. The ADMS Compliance Office and its officers does not have any authority to implement and the enforcement of any disciplinary action. We can make suggestions. It then stems to the Human Resource Department, the management of the local facility, and the governing body officers to implement that level of suggestion, or another level of suggestion, or none whatsoever, based upon the investigation done by ADMS. I wanted everybody to be clear on that the Compliance Department does not have the authority to discipline any employees, with the exception of those individuals who are part of the compliance team. Element 7 is the response and prevention. So after an offense has been detected, the organization must take all reasonable steps to respond appropriately to the offense, and then more importantly, to prevent further offenses in the future. ADMS requires issues of noncompliance be responded to in writing by appropriate management. This response would outline the corrective action to be taken, whom is going to take the action, and the time frame to deter the possibility of reoccurrence. Those suggested corrective action plans are then followed up on by the ADMS Compliance Department. Very similar to what goes on in a survey scenario. The eighth element is a risk assessment required, and that fell under the federal sentencing guidelines in 2004. Most people forget about the eighth element. Most people believe that there's only 7 elements, but the eighth element is sort of the forgotten child. And the risk assessment has been aided the eighth element of those that comprise an effective compliance program under the federal sentencing guidelines in 2004. Essentially, a detailed risk assessment is required to appropriately tailor a complete compliance program to a company. And there are two aspects of a risk assessment. First, it has to be a continual process. We just don't do a risk assessment plan at the end of 2015 for 2016 and assume that it's going to be the same throughout the course of the year. So as business situations change, as the organization change, as individuals and management changes, that risk assessment plan is going to change as well. And secondly, the results of the risk assessment should influence the design and implementation of the compliance program in order for it to be effective. So essentially, as we're going through risk assessments, we are going to modify the plan accordingly. If we are starting to see certain trends within our workplace, if we're starting to see certain trends within the dialysis industry, if we're starting to see certain trends within the healthcare industry as a whole, and affects the way how we conduct business and how our people act, respond, and are proactive, then we will address and correct our risk assessment plan moving forward. So those are the 8 elements. If you are ever asked, there are 8 elements in an effective compliance program. So where are some areas of compliance risk? Well, first off is patient information. Now, we all know we collect a lot of information about a patient's medical condition, their medical history, the types of medication, any family illnesses, in order for us to provide quality care. And we need to know, and we realize that, that's a sensitive piece of information. And we also all know that we're all committed to maintaining the confidentiality. However, consistent with HIPAA policies, the organization or its employees, we do not use, do not discuss, do not disclose any patient-specific information with others unless it is necessary to serve the patient or required by law. This also applies to situations where fellow employees become patients. In areas of relationship with physicians is also an area of compliance risk. Federal and state laws and regulations govern the relationship between the HCOs or healthcare organizations and physicians who may refer patients to the facilities. It's important that all arrangements with physicians be properly structured to comply with laws such as the Stark laws, anti-kickback laws, and the Internal Revenue Service regulations. Due to the complexity of these relationships, it's appropriate for you to seek guidance from the ADMS Enterprise Compliance Officer or speak to your own legal advisor. With respect to licensure and certification renewals, staff who hold positions which require professional licenses, certifications, or other credentials are responsible for maintaining the current status of their credentials and for complying with any federal or state requirements applicable to the roles. This healthcare organization does not allow any colleague, any independent contractor or practitioner to work without valid licenses or credentials. Speak to your local level administrator / center compliance officer or the ADMS Quality and Education Director for information regarding licensure and certification renewals and documentation. Billing practices. ADMS will only bill for services on behalf of the dialysis centers for those services actually rendered. And services rendered must be both accurately and completely documented and coded to ensure both proper billing and the integrity of the medical record. Billing has to comply with the requirements of the federal and the state payers and conform to all its payer contracts and agreements that we have in-house. There are also a number of federal and state laws that make it illegal to receive payments for false claims. Organizations that engage in practices that violate the False Claims Act could face fines and penalties. And there are processes in place within ADMS that support the detection and prevention of fraud and abuse, including internal and external billing and coding audits, a billing compliance committee. We do monthly monitoring and also employee education. Conflicts of interest. Now, a conflict of interest could occur if the activities you undertake or you have personal interests which appear to or influence your ability to make an objective decision required by your job. Now, in most situations, we try to minimize conflicts of interest, but if they do occur, disclose them to management. A good rule of thumb is that a potential conflict of interest may exist if at any time an independent objective observer might wonder if your actions are motivated solely by your responsibilities toward the organization or your work, or because you stand to get some type of personal benefit from the situation. Receiving gifts and business courtesies. Your local affiliate organization has some straightforward guidelines regarding policy about what type of things is appropriate for staff to accept from a person or organization it does business with, or you may want to do business with. I know at the annual compliance training year-end, we always talk about it with gifts from patients, gifts from outside organizations who want to conduct business with the dialysis center or already conducting business with the dialysis center. No member of an organization can accept cash or any cash equivalent such as gift certificates from anyone in a position to do business with it, regardless of the amount or whether it's directed at an individual or the department. You know, there are ways that vendors can extend a business courtesy to the employees that are appropriate. Check the policies and procedures that have already been established, or if you're unsure as to what's appropriate as a gift or courtesy, ask your local level compliance officer or contact the ADMS compliance office staff in College Point. How to respond if you think there's a violation? Well, steps should be taken to immediately correct any problems detected. If you think it's a misconduct, you know, we have a right to report misconduct to the appropriate governmental agency not more than 60 days after we have a credible evidence of a violation. We also detect violations in the investigation. We investigate any suspected violations ASAP as soon as possible. And if there's a billing and collection overpayment under the new rules effective March 22nd, 2016, known as CMS 6037F, any overpayments received from any of the federal authorities, which is Medicare, Medicaid, or any of the Advantage programs, should be promptly refunded within a 60-day window. Those are generally the rules and responses to detected violations. Now, under the Code of Conduct Standards, there is a number of standards here and really our commitment to the code, and I just want to touch upon these items briefly. First one is obviously quality of care and services. And the ADMS commitment is to improve the health of the community we serve by providing the highest quality healthcare services in a caring and efficient manner. Second standard is to deal with everyone in privacy and confidentiality. And our commitment is to fulfill the regulatory standards designed to handle all facets of information management, including reimbursement, coding, security, and patient records. The third standard has to deal with billing integrity and record keeping and coding. And our commitment is to maintain timely and accurate patient information and records and bill only for those services actually rendered as documents in patient medical records. The fourth standard is the standard of customer service. And our commitment is to apply core customer service standards to every interaction with every individual at all times, focusing on serving our patients and their families. The fifth standard is compliance with laws and regulations, and that's really to require all staff members to conduct their individual duties and all ADMS operations in a manner that meet the applicable legal, ethical, and regulatory standards. Our sixth standard deals with workplace conduct and employment practices. And the commitment is to create a work environment where employees, physicians, and all others are treated respectfully, fairly, and also afforded an opportunity for professional development. Our seventh standard is in the area of research and our research team. And our commitment is to follow those ethical standards in any research conducted by our physicians and our professional staff, including the research team. Our eighth standard has to deal with conflicts of interest, which we addressed briefly earlier. And our commitment is to regulate our activities to avoid any conflict of interest, any actual impropriety, or any appearance of impropriety. Remember the statement, you know, perception is actual reality. Our ninth standard is how to protect our corporate property, our corporate assets, and our corporate information. And our commitment is to protect the assets of others entrusted to us against loss, against theft, against destruction, and against misuse. So the Employee Code of Conduct, you know, we have an ethical behavior policy. Everyone needs to be aware that regardless if you're a physician owner, a privileged staff member such as a nurse administrator or physician assistant, any level employee, that following the Code of Conduct is mandatory for all employees, privileged staff and affiliated persons. While the Code of Conduct provides a basic description of unacceptable conduct or performance, it doesn't cover all the behaviors that may occur in the workplace. It's a general statement. Note that failure to comply with the Code of Conduct is a serious matter that can lead to disciplinary action, and we all know the terms, up to and including termination of employment and or privileges. So please ensure and get your Code of Conduct. If you don't know what you did with it when you were brought on board, please make sure you check with your local level compliance officer and get a copy of your Code of Conduct. So there's a joke. Knock, knock. Who's there? It's HIPAA. HIPAA who? Well, sorry, I can't tell you that. It's a bad joke, I know. So Code of Conduct and decision making. You know, at certain times, a difficult situation may present itself. And the right decision is not going to be clear or easy to make. So as you think about what you should do and how you should handle yourself, ask yourself these questions. You know, is there a law or regulations that governs the situation I'm involved with? You know, if there is, you know, should I be following that law all the times or just sometimes? Do we at ADMS or any of its affiliates, is there an internal policy and procedure that governs the situation? And would my actions be consistent with what that policy and situation is? Essentially, you know, would it be consistent with the organization's commitment to high ethical standards? If someone was looking from the outside in, what would they see my actions as being? Would I be comfortable explaining what I did to my friends and family? And then what would the most ethical person I know do in this situation? Think of those questions, folks, as you're put in certain situations. Doing the right thing, we all know it's not easy. All right, we've all been tempted to take the best way, even if it was not the best way. To take the easy way, pardon me, if it was not the best way. So avoid excuses for behavior that may not meet the requirements for Code of Conduct. And here's some of them. And we all hear them around the water cooler or the copy machine. You know, no one's going to know. I don't have time to do it the right way. You know, I saw my supervisor doing it this way the other day. See, that policy wasn't meant for me. It's meant for a different department. I've worked here long enough. After everything I've given this organization, you know what, I deserve something a little more in return. The general excuses that people may use for behavior that don't meet the requirements for the corporate Code of Conduct. Now, there's lots of resources available for you to determine whether or not there's a law, there's a regulation, a policy, a procedure, or standard that's going to help you. And I would ask that you reach out to any of the following folks if you really need some assistance. First off, again, reach out under the chain of command. Speak to your direct supervisor or manager. Speak to a representative of the ADMS resource office, a human resource office in College Point. Speak to your local level compliance department employee or someone from the ADMS compliance office in College Point. Or if it's real troubling, contact the compliance hotline at 718-483-7403. What's your responsibility to the organization? Well, the organization's commitment to compliance depends upon everyone's participation. In order for you to fulfill your role, we need you to commit the following. Number one, when the annual compliance training occurs in September, October, November, December, complete your annual compliance training as it's assigned to you. Please don't wait for someone from the ADS compliance team or your local level administrator to come back to you and say, hey, listen, you need to complete that. You know, look out for problem areas, you know, while on the job, areas where you're seeing non-compliance. And if you're aware of a violation of the Code of Conduct, you have an obligation to report it, whether it's to your line manager, the ADMS compliance office, or the compliance hotline at 7403. You know, and as a condition of your employment, agree to read and abide by the Code of Conduct and policies and procedures. Once again, if you don't know where your Code of Conduct is, reach out to a compliance officer, reach out to the ADMS Human Resource Office, get a copy of it and keep it in your file or keep it available on your ticket file on your desk. So employees are educated and trained each year on a number of different issues. Obviously, the first one is, you know, how to comply with laws, policies, and procedures. We also look for education and training that we do to spot potential compliance concerns. And some of these things you'll notice as raised in some of the compliance training that we do, such as unethical or illegal behavior. You know, medically unnecessary services being provided. the unfair or discriminatory treatment of a patient or any billing or coding errors that could benefit ADMS or any of its network of contracted affiliates. The unauthorized use or disclosure of protected health information. Those of you may recall Farrah Fawcett, who was a famous actress, died about a year or so ago. In the hospital where Ms. Fawcett was being seen while she was alive before she passed away, there was one employee who was a technician who accessed her medical record 154 days in a row, reviewing her medical records. And the individual was not within her department, was not within that wing that she was seeing care at, but this care technician was able to access her medical record for 154 straight days. You know, that would be an example of the unauthorized use or disclosure of protected health information on the extreme manner. Misuse of ADMS property in any areas which may exist regarding areas of fraud, waste, or abuse. So a conflict of interest in anti-kickback statute. So a conflict of interest, again, exists when you or a member of your family works for or has a financial relationship with a company that does business with, seeks to do business with, or competes with ADMS. The anti-kickback statute prohibits payments for referrals from physicians. So no employee can take anything, offer anything, or give anything either to a physician or from a physician in exchange for the referral of patients. The anti-kickback statute is a very serious and significant law. Please do not find yourself on the wrong side of the bench. Under the False Claims Act, which is a very telling name, the False Claims Act, or the FCA, imposes liability on any person who submits a claim to the federal government that he or she knows or should have known is false. An example would be a physician who submits a bill to Medicare for medical services that she knows that she hasn't provided. The False Claims Act also imposes liability on an individual who knowingly submits a false record in order to obtain payment from the government. An example of this may include a contractor who submits records that he knows or should have known as false and that indicate compliance with certain contractual requirements. And then the third area of liability includes instances in which someone may obtain money from the federal government to which he wasn't entitled, and then uses some false statements or records to cover up in order to retain the money. And this is what's called a reverse false claim. And they generally include healthcare organizations who get payments from Medicare throughout the year, and then they file a false cost report at the end of the year in order to avoid showing or having to make a refund back to the Medicare program. There are stiffer financial penalties for violations of the False Claims Act, and again, false claims can also result in individuals or organizations being excluded from participating in Medicare or Medicaid program, essentially being unable or ineligible to receive any federal or state monies. The False Claims Act is a very, very broad-stroked, very, very stiff, and very, very telling law. Healthcare fraud and abuse. And healthcare fraud generally refers to the intentional deception, that knowingly results from benefit to an organization, such as, again, you bill for services supplies that weren't actually furnished. You sign blank medical records or blank records. You falsify information on patient records. You offer bribes or some payment or incentive in exchange for any healthcare referrals. You misrepresent services as being covered or medically necessary when in fact they're not. And you assign the wrong diagnosis and procedure codes based upon certain coverage issues in order to get paid. Abuse practices lead to unnecessary costs to healthcare payers. And this differs from fraud because there's really no evidence that the act was committed intentionally. So it could be an error. And essentially it could be charging excessively for services or supplies. Providing services that don't meet certain professional standards. Or when you bill Medicare as a primary when instead it's Medicare secondary. That would be considered an area of healthcare abuse. Some of the consequences to fraud and abuse issues are the cost of coverage is probably the biggest single contributor to unnecessary spending is fraud and abuse. And the price tag for fraud and abuse is estimated at $100 billion each year. The losses caused by fraud and abuse are passed on, unfortunately, to individuals such as ourselves through higher insurance premiums, reduced wages or lack of ability to provide an annual increase, and sometimes increase the taxes to fund government programs. Under the Deficit Reduction Act, or DRA, and that generally applies to HCOs or healthcare organizations that make or receive at least $5 million or more in Medicaid payments in a fiscal year. The Deficit Reduction Act applies to employees, medical staff, vendors, and contractors. And these individuals have an obligation and a right to report false claims against Medicare or Medicaid and any other healthcare insurer. Whistleblower protections, or what's known as qui tam issues, can be afforded to those who report or undertake other actions available by law to either expose or assure that ADMS billing practices are appropriate. It's called whistleblower laws. And these are individuals or organizations who wind up contacting the federal government and saying, this organization is doing something inappropriate and we should investigate. All reporting under the Deficit Reduction Act, again, should be done under the chain of command. The recommendation is go to your supervisor, again, following the chain of command, and then use the ADMS Corporate Compliance Hotline at 718-483-7403. The compliance hotline is available and allows the opportunity to report suspected compliance violations when normal channels of communication are ineffective. Persons who choose to call the hotline to report their concerns remain anonymous. The hotline is available 7 days a week, 24 hours a day, and unless you provide your phone number and contact information, the phone calls into the compliance hotline are untraceable and all calls are remained anonymous. And once again, the ADMS compliance hotline is held at 718-483-7403. ADMS continues to review its business activities, ensuring that employees are abiding by the laws and established policies. And some of the ways that ADMS monitors activities includes, as we talked about, we perform background checks on new employees before they become on board. We audit departments to ensure that they are following the established written policies and procedures. And we also conduct monthly sanction screenings to ensure that physicians and staff are eligible to participate in Medicare and Medicaid programs and not found on any of the governmental exclusionary lists. We encourage and we expect their employees to report any concerns or suspected violations. Employees should first talk with their supervisor or again use the normal chain of command when reporting compliance issue, any observed or suspected HIPAA breach, or any other concern. No one will be punished or terminated simply for calling the hotline or reporting a compliance-related problem in good faith. You can also call the ADMS compliance officer, myself, directly, and my direct office line is 718-483-7428. Once again, 718-483-7428. All reported concerns will be reviewed, and any suspected violation brought to the attention of management will review promptly and will report it to the appropriate parties who will assist in resolving the problem. Please note that all reported information will be kept confidential and will only share with those individuals in a need-to-know basis in order to conduct an investigation or to correct the situation or as required by law. So we will keep the anonymity and confidentiality of the people reporting it for as long as we can, for as much as possible as we can. If an organization is found to be in violation of fraud, waste, and abuse laws or other healthcare violations, there are some penalties. Number one, if a person is found or organization is found, disciplinary action up to including termination of the contract or termination of employment. Again, you could be excluded from participation in either the Medicare and the Medicaid programs. There may be fines issued, and believe it or not, there could be jail sentences issued for employees, managers, administrators, physician extenders, and physicians. Virtually every week, there's always a story in a newspaper concerning an investigation of a healthcare provider or an organization. And quite honestly, ranked just behind violent crime and terrorism, healthcare fraud is targeted as a high-priority, white-collar crime of the federal prosecutors. Now, Congress has significantly increased the funding for healthcare fraud and abuse, and it's created a new criminal and civil enforcement tools that have enabled the government to expand and intensify the fight against healthcare fraud and healthcare abuse. Along with these increased investigation comes with the ability of the government to impose significant fines and penalties on organizations. Now, recently, the courts have been issuing, especially in the Eastern District here in New York and the Northeast, they've been imposing fines and penalties against individual managers for failing to assist with investigations and for ignoring what the government calls should have known scenarios. So by knowing or by conducting any manager, you should have been able to identify that this was a problem and you failed to do so. The government has responded with fines against managers and saying you were not doing your job. So they can impose significant fines and penalties on organizations, on individuals, including, again, disqualification from healthcare programs and as high as even prison terms. The Inspector General, or the OIG, believes that significant reductions in fraud and abuse liability can be accomplished through the use of ADMS compliance program. An effective compliance program minimizes the consequences resulting from a violation of the law and in some cases may convince a prosecutor not to pursue a criminal action. So the importance of having a compliance program is not that it looks good sitting on the corner of your desk, but rather the compliance program is an active, living, and breathing document that has changes to it annually, that's referred to annually, that people can speak to the policies and procedures in a first-hand knowledge, knowing that it is being active, that it is being used, that it is being referred to. That will assist in situations where an investigation is underway by the federal or state government, not a governmental authority wants to or feels it becomes necessary to issue any fines and penalties if we're conducting a compliance program to the best of our ability. The OIG has also provided the healthcare industry with model compliance program guidance, and there are specific elements that the OIG requires organizations to adopt to be considered as having an effective compliance program, essentially the 8 elements. Our response is that we have a voluntary development of our compliance program that we're talking about today, and that's based upon the OIG's 8-element requirements that ensure that we have policies and procedures, we have practices, and that we have a culture that fosters the understanding of and compliance with applicable legal requirements. Again, the purpose of our ethics compliance program is we want to prevent violations of the law. Where they do occur, we want to make sure that we detect the violations of the law, and then we want to document our efforts in the event any violations exist that aren't detected. Reporting concerns. So if you need guidance on a compliance issue and need to report a concern, do a couple of things again. First off, speak to your line manager, speak to your direct supervisor. For human resource related issues, we suggest that you call the human resource department first. As much as the ADMS compliance office likes speaking to employees, if it's a true human resource item first, please call the ADMS human resource office. You know, they are the HR experts. Let them work with you to address your issues. As a good practice, when you're comfortable in doing so and think it's appropriate under the circumstances, obviously speak to your line supervisor. But if you're uncomfortable in going to your supervisor, or if it's an inappropriate person to speak to considering the situation, then contact any other member of management confidentially, call the compliance officers, or use the ADMS compliance hotline. Employees should never feel that they have nowhere to go when they want to discuss a compliance-related concern. Some final thoughts before we go into some Q&A. Compliance impacts all our functional areas of organization, so it's just not a billing issue. It's just not a finance problem. We all have a responsibility to carry out certain activities that are ethical and that are legal and that support the behaviors within our Code of Ethics and Compliance Plan. Now, some of us here have jobs that are probably subject to greater levels of compliance scrutiny than others, and we all need to be familiar, though, with what those requirements are. The program doesn't need to be perfect, so long as that we continue to keep it as a live, active program. That's why, as I said, it's active. It's an evolving process. It's not a static document that sits on the corner of your desk. To the end, we can never say as an organization, we can never say as individuals that we've finished our complying. The very nature of a healthcare environment process and program eliminates any possibility of a final compliance product. Laws and rules, as we all know, change. And ADMS has positioned itself to be able to respond to and react to in a rapidly changing regulatory environment. Copies of this presentation can be obtained by contacting the ADMS Compliance Officer, Alex Osorio, at 347-312-3038. Once again, copies of the PDF presentation, call Alex Osorio at 347-312-3038. For more information, or if you want to schedule a live presentation at your location or discuss any specific part of the compliance program, contact the ADMS Enterprise Compliance Officer, William Cundiff, at 718-483-7428. Once again, 718-483-7428. Our next course or educational program in these monthly webinar Wednesdays is scheduled for next Wednesday, June 29th at 12 noon, and it'll be on HIPAA updates, HIPAA violations, and HIPAA enforcements. So look for an invitation on or before June 29th for 12 noon for the 1-hour program on HIPAA. Right now, we're going to leave it open. We're going to open up for questions and comments. I'm going to unmute the line. We'll go to the written questions first within the webinar, and then if none there, I'm going to go to phone calls. So hold on 1 second, please, as we just move the system over. Okay. Anyone with any questions at this time? If you do have questions, please type it in the lower right-hand corner of your screen, and we'll go there briefly first. Okay, there's no written questions. Are there any questions anyone wants to make on the phone? I'm unmuting the phones at this time. Anyone with any questions or comments from the phone that they'd like to raise at this point? Okay, given that there are no calls or comments at this point, I'm going to assume everyone has a great and excellent knowledge of the ADMS compliance program and the code of conduct. I'd like to thank you all for coming today and spending the last hour with us. And we look forward to seeing and speaking to everyone again on Wednesday, June 29th. If I don't have an opportunity to speak to everyone, have a wonderful Memorial Day weekend. And thank you once again for joining the ADMS compliance team on Webinar Wednesday and a discussion on the Code of Conduct and the compliance program. Thank you, everyone.